Now, blood circulatory system comprises of a central vascular pump, the heart, and a circuit of blood vessels through which blood flows. The blood circulatory system has three kinds of vessels, that is arteries, veins, and capillaries. The whole circulatory system has a common basic structure composed of three basic layers. Number one, inner layer, that is called tunica media, middle layer tunica, inner layer tunica intima, middle layer tunica media, and the outer layer is called as the tunica adventitia. Heart. Again, it has got three basic layers: endocardium, equivalent to tunica intima, myocardium, equivalent to tunica media, epicardium or visceral pericardium, equivalent to tunica adventitia. Now, heart layers present in endocardium, that is inner layer, lines heart chambers, smooth, thin layer that reduces the friction as the blood passes through heart chambers. Second layer is myocardium. Its middle layer contains thick muscle. Contraction of this layer develops the pressure required to pump blood through the blood vessels. Third layer is called epicardium. Its outer layer forms the visceral layer of pericardial sac. Fluid between layers of pericardial sac reduces the friction as heart beats and also provide the function of the shock absorbent. Here in this diagram we can see outer coverings are fibrous layer, then we can see parietal pericardium, then the visceral pericardium, in between is a gap that is called as the pericardial cavity, then is the thickest layer that is called the myocardium, and the innermost layer, the inner lining, is called as the endocardium. Again in this diagram, in a transfer section we can see outermost fibrous pericardium, then parietal pericardium, then there is a gap, then the pericardial cavity, and then we can see also the coronary blood vessels, they are just below them. Then is muscular layer, and the innermost layer is called as the endocardium. Then thickest muscular wall is called as myocardium, and the outermost just before the pericardial cavity is called as the epicardium or visceral pericardium. Now let's see the endocardium. The tunica intima is the heart. In the heart is known as the endocardium. It's lined by a layer of endothelium. Beneath the endothelium is a thin layer of subendothelial connective tissue. Deeper to the subendothelial connective tissue present a layer of loose connective tissue called the subendocardial layer. Again in this diagram we can also see the coverings on the inner and outer side and the thickest muscular layer which is present here. Then you can see in the outer layers parietal pericardium, visceral pericardium, and there is a pericardial cavity in between them. Again we can see in this diagram the thickness of the atrial endocardium is shown in this diagram. Myocardium. Consists of cardiac muscle. Thickness varies place to place, different in the atria and ventricles. Thinnest in atria and thickest in the left ventricle. Two layers are superficial and the deep. In the atria, the layers are not clearly demarcated. In the outer layer, muscle bundles run in an oblique or transverse directions and continue over both atria. In the deeper layer, muscle bundles are confined to each atrium separately and run at right angle to the muscle fibers of the outer layer. In the ventricles, muscle bundles take origin from annuli fibrosi. In the superficial layer, fibers follow a spiral course from the base of the ventricle to the apex. In the deeper layer, fibers pursue a circular course on each ventricle, forms S-shaped manner as the pass from one ventricle to another ventricle. In this diagram of myocardium, in the medium magnification we can see branching and debranching of the fibers of the heart muscle, presence of the deep purple color showing the nucleus centrally placed, maybe almost oval, and then fibers are branching and debranching and they're connecting again and again. So give an appearance of a ginger. In the high magnification we can see how the muscle fibers are going to connect with each other with the help of the intercalated disc and centrally placed big nucleus which is taking the deep purple dye. Cardiac muscle is involuntary and striated. Cells are branched and arranged in the form of chains. Branches are joined by special cellular junctions called intercalated discs. There is rich capillary network in around the muscle fibers. Its size varies from 100 micrometer. Nucleus single large centrally placed oval nucleus. Sarcoplasm contains abundant microfibrils and cell organelles like mitochondria, smooth endoplasmic reticulum, rough endoplasmic reticulum, and Golgi apparatus. In this diagram also we can see in HN, hematoxylin and eosin dye, we can see the centrally placed oval nucleus, and then we can see intercalated disc which is in between the end-to-end muscle fibers. Then we can also see the muscle cell nucleus, endothelial cell nucleus, and the capillaries are going in between these fibers. Inclusions contain mostly glycogen granules, fat droplets, lipofuscin pigment, and membrane-bound granules. In this cut section of the fiber of the heart muscle, we can see desmosomes are visible, gap junction is present, T-tubules, which is the characteristic of the cardiac muscle, is also visible over here. Sarcoplasmic reticulum we can see, intercalated disc is again seen, and cardiac myofibrils which contain the actin and the myosin filaments which form the dark and light bands, and the contraction of this causes the contraction of the muscle of the heart. Intercalated disc 0.5 to 1 micrometer thick, darkly staining transverse lines crossing the chains of cardiac cells at irregular intervals. The intercalated disc follows an irregular or strap-like course. Here in this diagram we can see intercalated discs are present, shown in blue color. Then cross striations are visible over here. We can see centrally placed nuclei and myocytes are also present in these cells. In this diagram we can also see intercalated disc, cardiac muscle cell its thickness, and centrally placed an oval nucleus which is situated over here in a muscle fiber. The intercalated discs are made up of fascia adherens, maculae adherens, and the gap junctions as visible with the indication of the eye, intercalated disc and nuclei. Arrows show the cross trabeculae. Now come to the epicardium. Tunica adventitia is known as the epicardium. The epicardium is the delicate inner visceral layer of the pericardium. The outer part of the epicardium is lined with mesothelium, which is a simple squamous epithelium. Beneath is a thin layer of connective tissue rich in elastic fibers. Here in this diagram we can see epicardium is attached to myocardium by subpericardial layer. So we can see outermost simple squamous epithelium in the adventitial layer. Then below that is the loose connective tissue having fat, also that is called as endothelium. Then we can see myocardium, thick layer, and then endocardium is the inner layer which is continuous with the tricuspid valve of the heart. Here in this diagram also we can see epicardium and its different parts are present here. Cardiac skeleton. The heart contains the skeleton of dense connective tissue which consists of three main components. Number 1, annuli fibrosi. Number 2, septum membranaceum. Number 3, trigona fibrosa. Here in this diagram we can also see structures around the valve, skeleton of the heart including fibrous rings around valves. Then we can see pulmonary semilunar valves, aortic semilunar valves. Tricuspid valve are the valve between the right atrium and ventricle, and on the left side we can see bicuspid valve which is present in between the left atrium and left ventricle. Then we can see cardiac muscle of the right ventricle and cardiac muscle of the left ventricle, which is the thickest one and it is the biggest chamber of the heart. Impulse generating and conducting system of the heart. Nature has provided a specialized type of the conducting system of the heart through which it generates its current itself, which goes through the course of the fibers of the heart in all directions and then go to the periphery and vanishes. So where the start of the impulse from the sinoatrial node and when it finishes at the Purkinje fibers in the peripheral part of the heart. So current travel through this network and the recording of this current is called as the ECG, that is electric cardiograph. Now sinoatrial node is present at the posterior wall of the right atrium. Then go to the next destination, that is the junction of the atrium and ventricle, that is called atrioventricular node, composed of spindle shaped cardiac muscle cells which are smaller in diameter than ordinary cells. Atrioventricular bundle consists of modified cardiac muscle fibers called as the Purkinje fibers. Here in this diagram we can see conducting system of the heart. that there is a nail-like structure present on the posterior upper part of the right atrium, where is the opening of the superior vena cava. This part of the conduction system generates current itself in millivolts. That current generates to the next destination, that is in between the atrioventricular, that is called atrioventricular node. Up to some distance, the node have a single thick fibrous band that is called as the bundle of His. Then in between the interventricular thick wall, the bundle of His bifurcates into two layers. On the left side it is called as the left bundle branch, and on the right side it is called as the right bundle branch. Then again near the apex, on the left and right side they turn toward the periphery, that is called as now the Purkinje fiber, and through that current reaches up to here and then vanishes, and then next the episode arises from the synovial node, AV node, bundle of His, right and left bundle branches and the Purkinje fiber, and this system goes on throughout the life. Purkinje fibers. These are modified cardiac muscle fibers. They mediate the coordinated contraction of cardiac muscle in each cycle. The wave of excitation starts from sinoatrial or the SA node, then spreads through the atria. This wave then reaches the atrioventricular or the AV node. From the AV node, wave reaches the ventricle through bundle of His. Bundle of His divides into branches called Purkinje fibers. The Purkinje fibers lie in subendocardium. Microscopically, these fibers are larger than cardiac muscle cells. Cytoplasm contains few myofibrils which are arranged in irregular manner. The cytoplasm is rich in mitochondria and glycogen. There are no T-tubules here in this conducting system, no intercalated disc. Cells are joined by gap junction of desmosomes. The cells of SA and AV nodes are supplied by large number of autonomic nerve fibers. Here in this diagram also we can see SA node and its generating impulse, then come to the atrioventricular node, then goes to the bundle of His, then that bifurcates into two, left and right side. Left side is called left bundle branch and right side is called as right bundle branch. Then near the apex they turn back to their own towards the periphery. Now that is called as the Purkinje fibers at the outer walls of the ventricles. Here in this diagram we can see myocardium and the Purkinje fibers. P stands for the Purkinje fibers and M for myocardium. Heart valves. Heart valve consists of a layer of collagenous tissue covered on both sides with endothelium. The endothelium is continuous with that of chambers of heart or great vessels. Central fibrous sheath is known as lamina fibrosa. The lamina fibrosa merges with the fibroelastic supporting layer, the subendothelium. Here we can see a shape of the heart valve in which we can see endothelium, submucosa, muscular layers as we have seen in this diagram.